My name is Valerie Washington, and this summer I participated at the University of Michigan Summer Research Opportunities Program. I worked under Dr. Marielle Lavieri at the Center for Healthcare Engineering and Patient Safety. I researched how to optimize patient flow through the University of Michigan C.S. Mott Children's Hospital Emergency Department by specifically looking at the implementation of a flexible use observation unit. Now, observation units are an alternative to admitting or discharging a patient by allowing doctors to observe patients for an extended period of time, which is typically less than 24 hours. We explored the flexible use of such an observation unit, which allows boarding patients to stay in an observation unit bed if space is available. Boarding patients are patients who have been admitted into inpatient care services but can't be moved simply because there is insufficient space to do so. Flexible use observation units have many benefits. The most notable benefit is that it allows for patients to be moved out of the emergency department, which leads to patients from the waiting room being able to be moved into the emergency department sooner. And this leads to improved patient outcomes for those patients since they're not waiting as long. The trade-off to this, however, is that blocking can occur. And blocking is when a patient who is an observation unit patient can't be observed in the observation unit because there's a boarding patient that's already being treated there. In order to measure the effectiveness of a flexible use observation unit, we performed a discrete event simulation using two different threshold policies. The first threshold policy states that there must be so many patients being treated in the observation unit before boarding patients can be moved into the observation unit. And the second policy states that there has to be a predetermined amount of beds being allocated towards observation unit patients and a certain being allocated towards flexible use. Future work on this project includes a cost analysis as well as expanding the threshold policies to vary by time of day and the day of the week, since the amount of patients coming into the emergency department does differ based on the time of day and the day of the week.